When it comes to your skin, call in the specialists. For a trusted, non-surgical solution to youthful skin, there is simply no better choice than Skin Renewal. Our clinics specialize in the full range of medical aesthetic treatments, using a wide range of medical-grade technology. Let our dream team of highly specialized doctors show you how to become the best version of yourself. Skin Renewal, the elixir of you.
Today we are back at Skin Renewal chatting to Dr. Kate and addressing some of Lianca's concerns. Skin Renewal offers a full range of doctor-administered medical aesthetic treatments, including injectables such as Botox and Dysport, dermal fillers and thread lifts, as well as a wide range of medical-grade technology, including lasers, CO2 laser skin resurfacing, radiofrequency, photodynamic light therapy, mesotherapy, microdermabrasion, laser hair removal, and facial rejuvenation. Today, Lianca and myself will be discussing and addressing acne and acne scarring with Dr. Kate and how to realistically treat this. We're so excited to be back with you again, Dr. Kate.
Thank you for having me.
And I think that Lianca's loving her treatment so far.
Yes.
And as in our first consultation, we discussed a little bit about acne and issues around that. So what is the process and how does that work, like with Lianca, or when clients come to you with acne scarring?
So an acne scar, it originates from acne. So if patients had acne in their teenage years, or patients can develop it in adulthood. And then it's either from bad habits at home, like picking the skin, or using the incorrect products that have caused dryness, and even unhealthy lifestyle habits that cause the acne scar to form. Yes.
How do you treat acne or scarring?
So with acne scarring, you have different scar types. So you have your ice pick scars, which are your deeper, narrower scars, and then you have your box scar and your rolling scars, which are a little bit more shallow and broader.
Okay.
So our box scar and our rolling scars are much easier to treat, and our ice pick scars are a little bit more difficult. Okay. So what we do is we combine a variety of treatments. We try to treat the scar from the top down and then from the bottom up. Okay. So when we're treating the scar from the bottom up, we would do something called subcision. Okay. And we basically excising the little fibrous bands that are holding the scar to your subcutaneous tissue or your fat. Okay. And we're trying to give it a more smoother appearance. And then when we're treating the scar from the top down, we do like our therapist treatments. So we do microneedling. Microneedling is tiny little needles that create controlled injuries in the skin, which stimulate collagen. We do our laser genesis. So that's our laser, which also stimulates collagen. And then we also have another medium called Carboxy Therapy. Okay, so Carboxy is a tiny little needle that we introduce under the skin, which also stimulates collagen. But we could also use it. I remember Lianca was telling me about her dark under eye circles.
Yes.
And it actually produces medical grade carbon dioxide gas. And that gets replaced with oxygen, and that increases circulation to the eye area.
Okay.
So we can treat her acne scarring and her dark under eye circles at the same time.
And can patients or your clients, what is the realistic expectations that they can have with this?
Well, with our deeper acne scars, like our ice pick scars, it is a longer journey. Okay, so we do manage the patient's expectations from the get-go with regards to that. But with our shallower scars, not as long of a process.
And what do you all offer at Skin Renewal with regards to this? Is there a skincare range that you can use with it, or is it just these procedures that you've been talking about?
So we do treatments, and we also prefer that the patients are on medical grade skincare. As I've mentioned previously, to cope with the treatments. And also we incorporate with acne scarring something called retinol, which is an overall resurfacer of the skin. We don't always start with that product because it's quite active. Yes. And it can cause some sensitivities. So we just see how Lianca handles the products that she's on, and then we would introduce the retinol.
I've heard of retinol before. It is quite intense, quite an active product.
Yes.
And you need to use sunblock with it, don't you?
Yes. And we
That's
always,
very important.
you get different types of strengths. So the patient would start on a lower strength, and they would only do it 2 nights a week, and then they'd build up. They'd do that for 1 month, then the next month they would do it 3 times a week, and then they'd eventually use it every day.
Just to get the skin used to it.
Yes.
And how many treatments is Lianca going to have, would you suggest for her?
So she's got mild acne scarring. I don't know if she sees it as that, but it is mild. And she'd probably need about 6 to 8 treatments, yes.
And is that weekly?
No, you would do it every 2 to 4 weeks, but that's after she's prepped.
So Dr. Kate, now with regards to one of Lianca's concerns, the dark circles under the eyes, and I know that so many people are affected or hate that dark rings under the eyes, you do have a procedure that you can do at Skin Renewal.
Okay, so for dark under eye circles, there are 4 main causes. So the one is genetic. You've got your poor sleep, if you've got any allergies or suffer with sinuses, but one of them is circulation. Okay, so we use a treatment called Carboxy Therapy, and what it involves is a small needle that we insert under the eye, and it produces medical grade carbon dioxide gas, and it actually forms a bit like a little bubble.
Sounds scary.
It's not scary. So that carbon dioxide then gets replaced by oxygen, and then the body increases circulation to that eye area. It also stimulates growth factors. That little injury that we make under the eye stimulates collagen, and the patients would usually come every 1 to 2 weeks, and then for a treatment course of about 8 to 12 treatments.
So that actually helps remove the darkness under the eyes.
Yes, it helps with the darkness.
And I'm sure also with anti-aging, it helps with the any wrinkles
with
or
darkness, anti-aging,
Yes.
and with Lianca, we're also going to treat her acne scarring. So
Yes,
we're going
with that.
Yeah.
Wow, that's amazing. I've never heard of that. Well, that's very exciting.
Yes.
And is there downtime? You just get a little bruise, you say, or a
So
little
you
bit of
can
swelling?
get a little bit of swelling, maybe a bit of bruising.
Yes.
But when you use any sort of needle,
Of
you
course.
can expect that, yes.
So tell me a little bit more about subcision. What is that?
Okay, so subcision is usually performed by a doctor, and what it does is it's working from the acne scar from the top up. Okay, so your acne scars are tethered to a fibrous band, and that's what gives them that rolling, jagged sort of appearance. So what we do is we take a blunt needle and we actually cut or subcise that band. And while we're doing that, we can inject some growth factors, serums to stimulate collagen. We can also inject filler to fill those scars.
Wow.
So that sort of procedure, we do probably about 1 to 3 treatments every 2 to 4 weeks, depending on how.
Yes, and
quickly
do you
patient
see
wants
results straight away, or is there time for the collagen to replenish? How does it work with that?
You can sometimes see results straight away when the patient has those
Yes,
that
very
rolling
deep. Yes.
appearance to their scars, but sometimes it does take a little bit of time.
Well, this is exciting. So you're going to have beautiful, smooth skin. And it does, I mean, the texture of the skin must be fabulous after all these treatments, I'm sure.
Yes.
Because that's what you're
Definitely.
working with. You're working so deep within the layers and helping with and smoothing out the texture of the skin.
And all of the treatments that we do for acne scarring also help with anti-aging. Yeah.
Which we all need.
We all, exactly.
Definitely.
Yes.
Okay, well, thank you. I think let's get going with this. It's very exciting. Thank you,
Great.
Dr. Kate. So Skin Renewal also carries an extensive range of clinically proven chemical peels which are supported by a wide range of medical-grade topical skincare products, such as Lamel, Neostrata, SkinCeuticals, and HelioCare, which it sells through all its branches as well as on its online store. So as you can see, beautiful skin requires commitment, not a miracle. Have a fantastic week. Take care, keep smiling and using that sunblock, and we will see you back here on Belito TV's A New You Season 2 next week.
When it comes to your skin, call in the specialists. For a trusted, non-surgical solution to youthful skin, there is simply no better choice than Skin Renewal. Our clinics specialize in the full range of medical aesthetic treatments, using a wide range of medical-grade technology. Let our dream team of highly specialized doctors show you how to become the best version of yourself. Skin Renewal, the elixir of you.